Good afternoon, everyone. We're going to go ahead and call the meeting to order.
Thank you so much.
Good afternoon.
Just going to take attendance. Forgot last time. As people come in. We also, here in the room, we have Patrick McCormick from Office Health and myself. And then we have online Alex, Sander, Melissa, Michael, and Raman Mirda, Dr. Walia, and Ms. Hayes, Dr. Hayes. Let's see. I learned that they asked for attendance, so I'll just write it down. Also, Bob Farwell from Otis Library is on vacation. He did want to let us know that he is retiring in June, and he will be sending a new representative from Otis Library when he returns from vacation. Also, for number 3 on our agenda, we have the minutes from our March meeting. I don't know if you had a chance to review those, if there's any corrections that are needed. Right, just a reminder too that if, go ahead.
No, I was going to say I didn't have any corrections.
We also have a reminder to anyone that has not finished the ethics training that is due on the Vector Solutions portal to complete the ethics training. It's about a 45-minute audio training with some questions at the end.
Do you need a motion to approve the minutes?
Can we have a motion to approve the minutes?
I'll make a motion.
Patrick,
I'll second.
okay.
All those in favor?
All those in favor? Aye.
I think when you do Zoom, Sarah, you have to do it by roll call when you do a hybrid.
Aye.
Sarah?
We do it, let's see, I'm City North, so Sander,
Aye.
aye, Melissa,
Aye.
Dr. Walia,
Aye.
and the names are around me, Michelle,
Aye.
and Sheila.
Yes.
Yes, we had a message in the chat. We could reach out to committee members to confirm if the ethics training documentation. I do have a list of people that she gave me that had not completed it. However, I believe it's about 30 days old, so I don't want to read your name if you already did complete it and embarrass you, but I will get the names of anyone who still needs it.
Thank you.
Okay.
Hi, welcome. We have another member joining us.
Hello.
Most of them are online. Hi. All right. So for area 6, we were talking last time about the 6 areas of focus and having our team members look at the various areas of focus and set initial goals
So
for
I
each
just didn't know
area.
if you wanted to had a like note taker on there.
Oh, yes. I'm trying to take notes and facilitate. So we were looking for someone who would take the minutes so that I can just put them in the minutes at the end and send it to the call. Do we have anyone interested in being a note taker?
And I'll jump up at once.
I love this, like students, how everybody looks down and away. How about we vote on a note taker for each session? So we don't have to have a permanent note taker. We just need one person each time we meet to take the notes.
I think that's fair.
Would anybody like to take the notes for today? And then you're off the hook for the rest of the year.
You want me to take the notes since I'm sitting here with you?
Thank you.
All right.
Patrick's going to take the notes today, and then he's off the hook.
Yeah,
the rest
except
of
I
the
left
year,
my
so-
glasses in the car, so God knows what I'm gonna write down.
So get ready for next month when I say note taker. You can all write this real fast.
I'll start from here because you already have the initial notes.
Yes, thank you. All right. So Patrick will take notes this meeting, and then we'll assign someone at each meeting. So the 6 areas of focus, we're going to assign members to each area of focus and set initial goals for the areas. Last month, we discussed goals 3 and 4, the health equity plan. Goals 5 and 6, data, aggregation, and analysis. Goals 7 and 8, direct services. And 9 and 10, internal city processes. And 2 and 11, umbrella, scope, mission, and vision. 13 and 14 were legislative advocacy. And 12 was goals and objectives. So we'll open up the floor to have a conversation about those 6 areas of focus and what the committee would like to do within those 6 areas.
Are you looking for suggestions or?
Yes,
Oh,
for the last month, we talked about the 6 areas
Yep.
of focus, and then we kind of broke them into like subcommittees, but then the committee had agreed that because we're having a kind of a hard time getting this committee up and going, instead of breaking off into 6 subcommittees, within this committee, we could work on those 6 areas.
Okay. Yeah, I was here last week. I was.
Hi,
Just
Sarah.
so that-
Oh, I'm sorry,
just-
Dr. Walia.
Sorry, just so that I can put it in perspective, could you kind of show that on screen so that I can get a kind of a visual of what those areas are concretely?
I will certainly try. I'm using the Norway Hall technology, so I don't know if I can access my documents from there. Let's see if I can reshare this with you. So it comes up here. It doesn't look like I can share it to the Google Meet. I can certainly read them again if you'd like. It's also in our invite.
So this is Patrick. Is it fair to be concerned that we only have anywhere from 6 to 8 members at a given meeting and we have 6 areas of focus that we're trying to assign people to? I just don't know if that's reasonable.
I agree with that. 'Cause
So
we
I-
have exactly 8 people today, which if it was quorum, that's 8.
Yeah.
So we have enough people to hold a meeting, but there are 6 big areas of focus.
Do we pick an initial like goals and objectives to start and then kind of work our way through the other objectives? Is that fair?
Yeah, I was going to suggest the same thing, Patrick, that due to our minimal attendance at each meeting, it seems more, especially if we're not going to go off and form other committees, if it would seem more feasible to have us pick a goal or a prioritized item out of the items that were originally projected, which are lofty and certainly valid, but just something beyond the scope of this size group, and see if there's a way that our group could coalesce on one item and try to make some impact on that.
I agree.
And I would just add direct care and services, because I'm from Generations Family Health Center. That's a natural for me that I was going to suggest. I was certainly happy to work in. But one of my questions was, especially after reading the health equity solutions data reports and summaries, et cetera, it seems there's been some surveys done across the area over time, and there are responses regarding concerns with access to care in different realms. I don't know how much of the specific data is available because these are very generic kind of survey results, pointing to a large number having concerns about access to care. But for our group to do anything with that, it doesn't get more specific than that. And UCFS, Generations, the hospitals would all say, we have different efforts going on, but we don't know how specific were the survey results to say, yes, but here's a concern over here, or here's our concern with this. et cetera. So it's kind of hard to direct intervention without knowing either A, that there's a new assessment going on to get some more specific guidance, or if there are details available from those previous surveys to say, to give more specifics, such as there's just not enough evening appointments across the city, or there's not enough this type of specialty care, or this language being spoken is running into barriers in particular places, or, you know, something to actually sink your teeth into and make a difference with. And so it's very generic, and I don't mean to be critical. It's just when we make decisions and plans around programming, it's more accurate to use specific information to try to drill down and make impact.
Would you suggest then that data from each agency be our first focus? Because when I'm looking at like even goals and objectives, without knowing the data and what the needs are in the community, I can't really determine what the objective would be.
Yeah, and I think we said that in one of our first meetings, that we didn't actually have data to work with that drove these goals being created and whatnot. So it seems like HES has done some things around surveying and whatnot, but their report is very graphic based and general results, as opposed to really drilling down on what some of the access issues are. And we could all make assumptions or go off and have grandiose ideas, but unless you know what the true results were, you're just kind of guessing.
So I don't know whether there's actual data available for the whole region as such, other than that generic data that was given. What I would suggest is, Generations, UCFS, Patrick, DPH, Uncas Health District has their own specific data with their experiences. Can we put those on the table and then pick out the most common ones from there and the important ones that we decide, and then work on those? And the hospitals have their own data, so they have their own focuses. So maybe we have a common focus that comes to the fore.
So this is Patrick. I was actually talking to Sarah a little bit before the meeting, and she had shared a piece of PowerPoint presentation before the meeting. And I just said, one of my concerns about the data sets we're using is to make sure that the data is statistically significant. So that way we're making appropriate assumptions, especially if we're dealing with race and culture, certain parts of our community. I just want to make sure that the numbers justify the approach we're taking to address a particular inequity within the community. So that would be my concern. That's why I think, as an example, the community needs assessment that Hartford Healthcare did, part of the work that they do, that's the organization or the contractor they use to be able to make sure that the data is statistically significant, it's correct. I just want to make sure we're not using data sets we're kind of picking from thin air, and then we don't know that we're using data that's correct. And I also want to make sure it's not so dated that it's not relevant today. It was from 3, 4, 5 years ago. That's not going to be helpful either. So I think we should set criteria for what the data is, and then what the dates are of the data we're using.
So we'll throw it out to the group. What data are you looking for? Within what date range, and who might be the person who can access that data through? And we're probably looking for 2 to 3 good pieces of data sets. I mean, of course, we don't want to limit ourselves, but.
So I've always thought the hospital data is always very helpful. The community health center data is always very helpful. TVCCA does a needs assessment, which could be very helpful. And then the schools data is typically, because it's annually done. So those are the areas where usually you start, and then you see how you can augment that data from other sources. I don't know if that sounds.
With the school data, which would be the nursing data sets that you're looking at? or
Actually,
the
usually we
attendance?
use the school, what is it, the thing that tells just the overall school information, what the heck, you can go right online to the school,
Or like ed sites, data sets,
no,
give
it's
you the
this,
demographics of the schools.
yeah, I mean, you have to give your data to the state every year
Mhm.
for, but I forget what they call it, the school,
report card,
something to
profile.
that effect, yeah, school profile. Yeah, so a lot of it's school profile data.
So for example, hospital data, who would be able to get the hospital data?
It's actually online. Michelle's sort of the person for it, but it's all available now. And the community health improvement plan is correct, Michelle?
Yes, I'm trying to pull it up right now. I can pop it into the chat. It's all up on our website.
Once you have it in chat, we'll also add it to next month's agenda, so all the data sets are together.
The good part about some of that data is I mean, obviously we have to focus on the city, but you can use comparable data from the region to decide whether or not the problem or issue is specific to Norwich, or if it's a regional issue, or how we compare to other cities in the region or state.
It does compare Norwich to other areas as well. So the hospital service area plus the state of Connecticut.
And it's right there in the chat.
So Patrick, are you thinking each of our, like UCFS generations, UNCUS, et cetera, looks at this and tries to, for the health section, run comparable info to put together all of ours in terms of trying to compare apples to apples, you know, obviously prorated on terms of your numbers, but you know, if Hartford Healthcare saw, for example, a disparity with diabetes education, and Generation sees a disparity with diabetes ed, you know, et cetera, that there could be trends we try to pick out that might point to appropriate interventions.
Yes.
Okay. Yeah, we could attempt that. So we might want a subcommittee offline of just the service providers to look at health data for what's available then. And then share it with the group.
And the interesting part with like the city of Norwich is they may be applying for a grant in the last year that may have required them to provide relevant data to, you know, whatever, to apply for whatever funding sources. So a lot of times the city isn't doing it on an annual basis. They don't have a needs assessment requirement, but they have to collect that data and provide it in some sort of a format if they're applying for an application for a grant. So it's just who's that key contact for that type of information.
Mhm.
And it may be the department head or something to that effect. I mean, I assume Kate's probably going to have sources of data that would be helpful to support this as well.
So Melissa, if I'm hearing you right, we're thinking that we will gather up all the data and have a few select volunteers or a small subcommittee put together data for next month's meeting, so that we can look at trends and set goals and objectives around direct care and some of the other areas that are impacted.
Sorry, on mute. I think we can attempt it. You know, I'm looking at their pages really quickly. I think some of it, we can generate here as far as generations data for similar categories and whatnot, and try to align as much as possible. And UCFS, I mean, I know that our annual report to the feds is the same, Dr. Walia. So, you know, it's just as far as how we label things in our EHRs and whatnot, and the ease of pulling that data out, and then try to align it for trend comparison and share with the group, and maybe we have one conversation before that meeting of all of us to just say, okay, or we share an email, group where we say, gee, it looks like this. This is what to us, this looks like trends. And kind of get some agreement amongst us. This is all predicated on the fact that we focus on direct care and services as opposed to anything else. Being in the primary care world, we're always going to try to focus on actual delivery of care, as opposed to some of the other goals, which are, more philosophical and strategic. We can certainly participate in those, but as far as making impact, that's kind of our natural lane. Dr.
Yeah.
Walia, you probably.
That's where our comfort level is also.
Yeah.
So, and I can be very passionate about.
Yep. Happy to contribute to other goals, just
Yeah.
that's kind of our lane. Can't speak for other committee members.
Earlier to look at the data and then focus on one area, since we are such a small committee as far as attendance, being consistent. Is there anyone in particular that would like to be on that subcommittee for data to meet about 1 week prior to our next meeting to review the data sets that you have?
Say again, I couldn't hear that.
Is there anyone that would like to be on that subcommittee that wants to meet like a week or two prior to our, I think our next meeting is like May 10th or so, it's the second week of May, to just look at the data before we present it at our next meeting?
I could volunteer for that. Yeah, absolutely.
Dr. Walia,
Kate may want to. She's just out this week. but-
Kate, Millie? I'm happy to represent the school. There's a lot of school data, so just pretending on what in particular you would like from that data. Everything from immunizations that we have and not have, as well as students' medical care, percentage of students with diabetes. We have a lot of information, so I'm not sure what you would like. I can even tell you how many times we go to the nurse's office.
I think it might be, but I think it could be more general data too. It's things like poverty within the city and, areas where you feel like health inequities may occur as a result of them, aligning with the social inequities that we all know are, that will cause people to have poor health.
Yeah, if someone else wants to work on that while we work on our organizational data, that would be helpful.
How can someone determine poverty levels in the school? Do you have like how do they know?
So we used to do it based on free and reduced lunch. but
That's what I was
currently
thinking.
100% of Norwich students get free lunch, so
Okay.
we don't have socioeconomic data at this time because everybody gets free lunch.
So there's no other place you draw from, for any socioeconomic data.
I can check with our PISIS system manager
Hmm.
because we have to report it somewhere, even though
I mean,
we don't
there's the-
collect SNAP
yeah.
information anymore.
I mean, there's always the things you put into every grant, we're in a medically underserved area, we're in this area, we're into that area. I mean, you can make certain assumptions just based on classifications.
Yeah,
but-
in our grants, we qualify for 100% free and reduced lunch, so we're able to qualify as 100%.
So that alone is the type of
poverty.
data we're talking about, yeah.
Yeah,
And how many, we may be looking at something like, how does the city of Norwich compare to other cities in the region? And maybe off the top of my head, maybe like Groton, New London and Norwich may meet that requirement, or Watford, I don't know.
I could definitely see who meets it and who
Yeah.
doesn't meet it.
So we
I
may
don't know.
say, within our particular area, Norwich really is the hub for folks that are going to be faced with poverty as a result of that information, something like that. I mean, I think we're making large assumptions to start, and then we have to drill down a little bit. I mean, because there's parts of this that talk about internal city processes, and that's nothing that most of the people that are on this particular committee are going to be able to address. But you may be able to say, now, based on the information we provided to you as the city agencies or city departments, that you now know that, your hiring process doesn't hire in those communities where they see the most inequity or something like that. And then you decide to, so I mean, it may be a year from now, you start making policy decisions based on what we find from data.
Right.
It would help if somebody could reach out to Health Equity Solutions too, to see if there's more specific data available from the surveys that they did, because those are very kind of generic results. That just kind of sum up, 41% said there was a problem with access to healthcare. Okay, and like that's, if they had something more specific from it that they just didn't include, they rolled it up probably to do their graphics and whatnot, but if they had something more specific, that'd be really helpful. And where did they have specifics per Norwich, et cetera?
And I think Kate was the one who said she'd be the contact for them.
Yes, she
So
did.
maybe we can reach out to Kate.
And she may already have that. She's just not in today. And then it looks like there's a proposal for May 1st at 2:30 for the subcommittee to meet with any data sets that they were able to locate. Does that time and date work for everybody?
Dr. Well, yeah, I can do a different day if there's a different time.
Yeah,
that's
so
better.
I return on the 1st of May, so probably the third Wednesday would suit me, also Monday or Wednesdays. So that Monday I'm not there, but Wednesday would be fine.
May 3rd.
So we'll put May 3rd as a tentative.
Yeah.
I'm
the
okay between 1 and 3. I don't know about you, Dr. Well, yeah, this first time of the
I'm
day.
just looking.
Okay,
Yeah, 1 o'clock is fine.
Right, so 1 o'clock on May 3rd, subcommittee for data.
Yeah.
So far, Dr. Walia, Kate, Sarah,
And Melissa.
Missy.
Yep.
Michelle, are you able to possibly attend that?
Joe would be the one, I think, because he's definitely more well versed in this than I am, but his schedule is open on May 3rd.
Is somebody going to send an invitation so Kate knows?
Yes,
Okay.
we will send an invitation this evening after this meeting ends.
Thank you.
Perfect.
I didn't
Thank
get
you.
My computer again.
so that just gets back to, are we agreeing to focus on one particular area, or I don't have contact with the people who created this, so I don't know if there was a sense of urgency on any of the other goals that are listed.
When I spoke to Kate, she had said that all the areas were areas to tackle, and unless someone has an objection in this meeting, it sounds like bringing data, looking at data and looking at the needs of the community would be the first step before even making goals, even if those goals are around direct services or any other areas of it. Because to Patrick's point, we won't even be able to recommend policy if we don't know what the data is telling us and what the needs are.
Yeah, so the data will tell us what goals to set for various other, I still don't have that. If you can share that with me, that would be awesome. The 6 areas, the data could have elements of each of the 6 areas in them or more than one, and we could focus on more than one that way. So start with the data, of course.
I think from my perspective, our response would be you tasked us with doing this, and for us to do it properly, we need to look at data first if they happen to ask why we haven't looked at everything. If they don't like that response, then they shouldn't have put us on the.
I'm gonna jump. Listen, Sheila, I'm gonna jump in and say, I think more of the reason this resolution was adopted was to really come out with a substantive plan with goals that the city and the area and the region could implement. The original resolution was passed back in 2021. So if urgency was the issue, we've passed the urgency. But I think knowing that we have to report semi-annually, I think we should look at, Sarah gave a report March 31st. Our next report would be due sometime in the fall. I think as long as we're showing progress and that we're addressing the 13 areas that were put into the resolution, addressing them in a process, not just let's do all 13 to do them. And I think if the process is laid out, I think, it would then be up to the council to give us feedback if it's not the direction that they had anticipated or the time frame they anticipated. But there was no response Monday night to your first report. It was accepted. There was no discussion. So I'm going to say proceed as we're proceeding.
Sheila, can I ask, for a committee like this, is there typically a council member that attends the meetings at least on an infrequent basis to be able to at least share in the discussion, so that way they bring back and report to the council, or no?
No, that's why they built in semi-annual reporting. So no, because I'm not being facetious when I say this, but what would they really offer at this level? And when we come out of this at the end, like there's one of the goals, and I'm looking at the 6, what legislative action or advocacy do we want to put forth? What goals and objectives? There will be a review of internal city processes. So those are the 3 that I look at that we may be asking the city to either adopt a resolution or to work with the state and federal reps. I see that we would be asking them to do an action out of this. I don't see them being involved at this level.
Well, and there was a lot of legislative action for healthcare this round,
Right.
session. So, somebody could certainly put together all the bills that have been submitted. There's been many. How many end up on the cutting room floor? I don't know, but I see what you're saying, that if we end up with recommendations that then go to the legislators as opposed to the other way around, they've been very active this session.
Right. And I don't mind it can be a committee or if people want to rely on me, I don't mind working with, or at least our state officials to find out, when we get to May and June, which ones were adopted. Because that's really, it doesn't matter how many, Senator Austin put in 89 bills herself. Okay. It's really which ones are they going to adopt and what's the level of funding. And I don't have a problem, having that information be sent to me when it is adopted. When it's passed. Yes, we still have to wait for the governor to sign it, but at least we would know it had been passed, and we would know whether he was going to veto it or not in advance. Because a lot of these bills, it's do they have the can they count? I hate to say it, I think it's 76 and 100 and something votes is what it takes to get them passed. So I don't have, like I said, I'll offer to be a part of the legislative advocacy group to at least start collecting those bills as they are passed at the state level.
Appreciate that.
So my only thought with the council was, because this was formed out of the council, I didn't want us to go into a council meeting somewhere, or Sarah to go into a council meeting, or whoever may have to do it, and the council turns around and says, well, this isn't really what we were looking for, or, I don't feel like you're making this way. If they're part of the process at this level, then we have those discussions early, and we don't go to a council meeting and have it be a public forum where they question the work of the committee.
No, and I think if we have questions along the way, you don't have to wait till the report, Patrick.
Yeah.
We could always ask for either through the city manager or with the council to have a discussion with them if there's something that we really felt we needed their input.
Okay.
Okay. And I think if you look at the 13, and I know Sarah doesn't have a chance to put them up, but if you look at the 13 of these, it's really community based and organization based, which is why the specific organizations and or individuals were invited to participate.
So just closing out number 6 for our agenda item, we're going to be bringing different sets of data based on our area of expertise or our role and responsibility, and where we work to a subcommittee meeting on May 3rd at 1 p.m. Right now, that is Michelle, possibly Joe. I'll go. I'll invite Joe too. Melissa, Dr. Walia, myself, and Kate, attending that subcommittee meeting to ensure that we have data for you on our next meeting in May. And then from that data, hopefully we can draw some parallels and develop goals and objectives for this committee. Or at least a bunch of questions of notices and wonderings of the data that lead us to find more data, whichever happens. Anything else on item number 6? Okay. So item number 7, just remember that if you cannot attend, please send a representative or nominate somebody from your organization to attend. Just from the city council perspective, we all have to know if we miss more than meetings consecutively, we could be asked to resign from the committee. And then under other items.
Wait, I'm sorry, Sarah, go back and say your last part.
From the city council, if we miss more than 3 consecutive meetings, we could be asked to resign from our role on the committee.
I believe in Bridget, you may be able to help. I believe the committee has to, I believe we have to take an action of one or two of a couple of ways. Either we write the person I'm going back to personnel and personnel and pension and personnel, Bridget. I believe we wrote the letter.
I think we were generous on the personnel and pension board. I think the charter says that if you miss 3 meetings, you will be considered resigned. So, I mean, is there a little leeway there? Yes. And it really doesn't make sense to eliminate an organization without having another representative from that organization if they're of value to the committee. So perhaps if a representative doesn't show, then we, ask the organization to come up with another person.
Right, but I'm saying is we did it by letter.
Yes, I think we
Right,
did by
that's-
letter or email,
Right, right. There was a
written communication.
right. Sarah, what I'm saying is I think we've gone past. I know that we've talked, there's a couple of people, or at least one person who hasn't attended any meetings.
Is their organization being represented by somebody else?
I don't know.
Okay.
I don't know, because I don't have that list in front of me. That was a different, they amended the original list. I'd have to go back and see whether it was, I thought I was the only person by name and everybody else was named with an option for an alternative, but I'm not sure.
Yeah, and I had mentioned that Arvin Shaw has never been able to attend. He retired from Generations, so I am the representative from Generations and have been attending. So I don't know how we formally get the name change, but I haven't been listed in any of the minutes, but I'm the one that's been attending and he's never been because he retired.
You're not in our minutes for March? Yeah, Melissa Myers,
No, oh,
you're in our minutes.
I don't see my name in the members. Sorry, I was looking on the agenda. Sorry, I apologize.
You're in the agenda.
And you're on the agenda too.
Second to last name.
On my agenda, it does not have my name.
Oh,
So I don't, the last name is Sarah. So I don't know.
so like
But
Erica,
anyway, I don't know how it formally gets changed.
right. So there's Erica Brennan, who has, and I don't know if she's representing an organization, but she is never, for an example, I don't believe she's ever attended because I believe we were told her work schedule doesn't allow her to attend at this time.
Can you say that name for me again? I'll confirm.
Erica Brennan.
And was she with a particular organization?
I can't remember. You have to go,
Or named. I think organizations maybe should have been named instead of people.
Yeah,
well, they put a person's name or a designee. That's in most instances.
Yeah, there's nothing to say the organization is even aware of the fact the person was
Right.
appointed or has not attended.
Right, so we'll look into that. and see if we can get a-
Right. So I'm just like with that particular person, if there is an organization, I would suggest, I'd make a motion that we contact the organization.
Anybody second?
I'll second.
Thank you.
Yeah.
I'll look into that, Sheila, and contact the organization if one was tied to her name to see who would be the rep.
Right.
All those in favor?
All those in favor?
Aye.
Aye.
First, Sheila, to call you,
Aye.
right?
And I know I don't mean to be a pain, but I think you have to do roll call because you have a hybrid.
Absolutely. Melissa,
Aye.
Dr. Walia,
Aye.
Dr. Mavu,
Aye.
Bresnak.
Michelle,
Um,
aye.
Sheila,
Yes.
Bridget,
Yes.
and Patrick.
Aye, yes.
Okay, that's everyone. Looking at number 8, we just had some other items for you, which include the semi-annual report that was due to the city council. We didn't have a lot to report out on, but the members' names were on it, as well as just that we've met and we've started to look at the resolutions. In addition to looking at the data after our subcommittee meeting, is there anything else you'd like to see on the agenda for the May meeting? So right now, our plan for the May meeting is for the subcommittee to present out the data sets that they've discussed, and then for the committee to set some initial draft goals and objectives around those data sets. Okay. Motion to adjourn. I had to think of the word, sorry.
I'll make the motion, Patrick.
Second.
Melissa has second.
Third.
Right.
Now you have to go through everybody again to,
Now I go through everyone again, hold on. Melissa,
Aye.
Michelle.
Aye.
Sheila,
Yes.
Dr. Walia,
Yes.
Alexander,
Yes.
Patrick.
Yes.
And Bridget.
Yes.
All right. Have a wonderful rest of your week. Enjoy the beautiful weather, and we'll get the next agenda out shortly.
Aye.